Hello, everyone. Happy Monday. It's November 2nd. I'm Rundy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department, here to give you our Monday update on the impact of COVID-19 on Mobile County. So in the U.S., we have around 9.2 million cases of COVID-19 disease, and 231 of those have died with COVID. In Alabama today, we're at 194,892 cases with 2,973 deaths. And I saw in a data visualization this morning where when you look at the number of cases by state adjusted for the population, that Alabama ranks fourth highest in the nation with the per capita number of COVID cases. So just to put it into a little bit of perspective there. If you are following along and check the Alabama Department of Public Health website, alabamapublichealth.gov, to see their dashboard, you have probably noticed a couple of notices that have been placed there to describe processing backlogs of lab results on October 31st and then on November 1st that needed some adjustment. So those did not occur in Mobile County. Those were in other geographic locations. But just a reminder that the backlog that created the spike that we saw on 10/22, that happens all over the state and all over the U.S. So, there's so many points at which things can go wrong technically with that electronic message that goes from a doctor's office to a laboratory to the state health department to CDC. So there are often delays that aren't always a result of something that we did or didn't do. All right, so in Mobile County today, our daily report, on Monday we have the daily report, the brief report, and then the more lengthy expanded report. So in our daily report, we're reporting on 445 cases. 40 cases of COVID-19 were added yesterday, Sunday. 49 were added on Saturday and 87 on Friday. We had a little bit of an artificial bump on Friday due to a lab processing, but it didn't look much different than normal. So again, 40 cases added yesterday. We're at 324 deaths, 2,302 that have been hospitalized with COVID-19. That is a cumulative number since March. And then yesterday, there were 84 people in the hospital with COVID-19. That number of people who've been hospitalized with COVID is creeping up a little bit. We're keeping a very close eye on that. We talk quite a bit about how the younger populations, high school, young adult, college-age kids, people who are, in their early 20s that aren't in college but that work and socialize around the county is really what has been driving our community transmission. And when we start seeing that happening like we did, a month or so ago, then it's generally followed by an increase in older populations. So it's, young folks unintentionally exposing older people who are more vulnerable. So we start to see the number of hospitalizations and deaths creep up. So in our weekly expanded report, the rate of COVID, so this is, again, the number of cases adjusted for the population, is 4,186 per 100,000 population. So that's creeping up a little bit. The number of cases reported last week, this is why I brought my glasses, looks like it's around 421. That's up slightly from the few weeks before, but not crazy. And again, if you look at the numbers reported by month, take a close look at our report, because what we're trying to do is sort of help you discriminate between that artificial spike. So here that's the October 22nd when we had that artificial spike, and all of those were probable cases, so they're shaded in gray. So the blue cases are the confirmed ones. So if you just look at the blue section, it looks about the same as other day. And the same goes true if we look at the number of cases reported by week and reported by month. That if you sort of, focus your eye on the blue cases, which are the confirmed ones, it looks about the same as the previous time frame. So again, just hoping, kind of reading between the lines and not letting that spike of, 2,400 cases, 2,500 cases, scare you off too much from what that looks like. Because again, those occurred all the way back starting in June through October 18th. So we still are seeing the highest rate and the highest number of cases reported in that 18 to 24 age group. The rate in the 18 to 24 age group is 6,823 cases per 100,000 people, compared to like 0 to 4, which is around 1,400. So not much is changing there. We're just seem to be adding and adding and adding cases. So our 7 and 14-day moving averages are going to look a little squirrely until we can get past that October 22nd spike. But we look at the moving average number of people hospitalized with COVID each day. That seems to be trending up a little bit. But again, we were in the 70s, the last previous 7-day period, and the last 4 or 5 days we've been in the 80s. So not getting crazy out there yet. So thank you for continuing to do the things that you need to do to slow transmission. If we look at our emergency department visits, about 1% of those are for influenza-like illness, and around 2% of those are for COVID-like illness. So now that we're in flu season, it's very important that you get a flu shot, because we're going to have flu and influenza and all of the other upper respiratory viruses circulating this flu season, and it's going to be quite difficult to try to tease out or diagnose upper respiratory disease. Last week, there were 4 deaths reported. That was the same as the week before, so that's looking pretty good. Just to remind you that 95% of all the COVID deaths occur in people 50 or older. For the percent positive laboratory tests, last week we were at 6%. We still have plenty of testing going on and being reported to us, but our percent positive is creeping up a little bit to 6%. However, as I've discussed before, the tests that are reported most consistently to us are the confirmatory PCR tests, because those have to be done in a highly complex molecular laboratory, and those are the labs that have been reporting electronically to us. The newer point of care or rapid tests that, mostly sick people want a rapid test to know their test results as quickly as possible. That can be done in a provider's office, in a urgent care, in a nursing home now. So most of those results are not consistently reported to us, both the positive and the negatives. So we're not able to include them in our percent positive calculation. Even if we do get it, if they're only giving us positives, then we're not able to include that in the calculation. So we know from some of our partners that are reporting in aggregate to us outside of the traditional public health system that at least one location with several clinics across Mobile is seeing about 20% of test positive, which is extremely alarming. That is as high as we've seen it since March. We got around 19-20%. In the early April, we hit 20% again in mid-July when we had our summer peak, and now we're up in some locations up around 20%, which is extremely alarming. So if you look at the updated map, again, this is just the rate, so adjusted for the population. The zip code with the highest number of cases per population was 36571, with between 1,500 and 2,000 cases per 100,000 people. Again, just adjusted for the population, but the rate highest in 36571, and then second highest in 36608. And then if we just look at the pure cases, just looking at the cases where they map according to residents of the address, we're seeing 36609 and 36693 having a lot of clusters or hot spots, and then the eastern sections of 36608, and then all of eastern 36608 and all of 36618. So if you're in those zip codes, please, if you have underlying medical conditions or you are older and more vulnerable to complications of COVID, please try to stay inside and have someone else run your errands. Please watch church online if you can. Try to stay home as much as possible in those geographies where we know that we're having higher transmission. So I mentioned this on Friday, the ADPH risk indicator dashboard refreshed, and Mobile is now in the moderate risk category. Let's see. All right, now just a couple of things to mention. So I hope everyone had a great weekend. The weather was just gorgeous. I know many of you were still recovering from the storm, and for those of you that are still impacted, maybe still don't have power, our hearts are with you. I think everybody in the county has been impacted adversely with the storm, whether you live on the coast or live inland. We still have plenty of employees, and we have 2 locations that are still not open because of the storm effects. But hopefully you safely Halloweened over the weekend, took some of those tips to heart to try to keep a high risk activity as low risk as it can be. So we have another big thing to look forward to tomorrow. So tomorrow is election day, and we just want to share with you some tips of staying safe and reducing your risk of exposure to COVID-19 in the polling locations. And just we've been talking, the Unified Command talks at least twice a week these last couple of months, and they've been talking about doing all the things that they're working on to keep the polling locations safe, and we feel very good about the things that are being put in place to try to reduce the risk of transmission of COVID at the polling station. And the health department will be supporting them, so we're going to be sending some extra hand sanitizer. If they find themselves running low on masks, that sort of thing, then they can give us a call and we'll help out. So we will be supporting the work of the probate court and the county commissioners to make sure that all of the polling locations are as safe as they can be. Now, with that, you have some things that you can do as well. So again, what we're trying to do is, the guiding principle behind lowering your risk of transmission is really to reduce the length of time that people interact with each other, because the longer you interact with someone, the higher your risk of transmitting COVID. And we want to reduce the spread further by distancing, so having that 6 foot of distance. We still want you not shaking hands or hugging. So if we're going to be at our local churches or at our community center or our schools to vote, it's likely we may see people that we haven't seen in quite some time. So please resist the urge to shake hands. I know it's instinctual to some folks, but you can do the elbow bump or the fist bump, but please avoid hugging and shaking hands, and maintain that distance. Wear your facial covering. Wash your hands or use hand sanitizers before entering and then after leaving the polling location. And the polling locations should have hand sanitizer everywhere. So frequently disinfect your hands even when you're in the polling location. So anytime if you touch a doorknob or a table or your voting location, always make sure afterwards you wash your hands. Cover coughs and sneezes with a tissue and then throw the tissue in a lined garbage bag. If you don't have a tissue, then cough or sneeze into your elbow. So this is the cover your cough now. We don't do coughing like this anymore, right? We don't cover our coughs and sneezes with our hands. Try to avoid sneezing like this, but do it into your elbow. Let's see. Wear a facial covering, maintain 6 feet, and 6 feet is about 2 arms length. So if you stretch out your arm and the other person stretches theirs and you're not touching, then you're just about the right distance away. And again, try to avoid crowds. If you can, vote during off-peak hours. I decided to take half a day off tomorrow so that I could vote safely with my spouse, so that we could go to the polls at a time that's not before work or at lunch or after work where it might be busier. If you have the luxury of having some time off to do that, please consider it. And prepare yourself before getting to the polling location. Make sure you have your photo ID. Review a sample ballot ahead of time so that when you get to the polling location, you can minimize the length of time that you're there so that you can get in, cast your ballot, and then get out as quickly as possible. You might take your own black ink pen as well, although I'm pretty sure everybody is going to get their own pen when they get to the polling location. So I will stop with that, and on Friday we will talk about some of the findings of some of the scientific studies that have been published recently, because they will sort of illuminate and sort of raise our understanding of the outbreak more to a national and global level. Whereas we really focus every day on some local things, there are some really interesting things coming out on the science of COVID-19, and we might hit a few of those on Friday. Keep your eye on Hurricane Eta. Doesn't look like right now it's going to threaten us, but you never know. So again, you might want to just keep your hurricane pack together for another week or 10 days while we watch that storm in the Atlantic. So be safe, and we'll talk to you on Friday.